I am Dr. Alina Serratia, and after many years of caring for older adults, I have learned one lesson that I never ignore. The body often whispers before it screams. Diabetes is one of those conditions that can leave clues long before a person hears the word from a doctor. Very often, those clues appear in the feet first. That surprises many people because they expect a problem with blood sugar to show up as thirst, weight change, or tiredness. Yet, the feet are where I often see the earliest, quiet signs. If you are over 60, this matters deeply because small changes in the feet can be easy to brush aside, and that is exactly what makes them dangerous. Many people tell me the same thing when they come to see me. They say the numbness felt small, the dryness seemed normal, and the color change looked harmless. They thought it was age, weather, old shoes, or a long day on their feet. I understand why they think that way. Aging does bring changes, and not every ache means disease. But diabetes can hide inside those everyday changes and slowly harm the nerves, blood vessels, skin, and even the kidneys. The feet become a kind of message board for that damage. They are far from the heart, they depend on good circulation, and they rely on healthy nerves to feel heat, pain, and pressure. When blood sugar stays high, the feet often pay the price early. I remember one patient very clearly. He was 68, kind, independent, and proud of how rarely he complained. He came to me because a small cut near his toe had not healed in weeks. When I asked about other symptoms, he mentioned tingling at night, dry, cracked heels, and feet that felt cold even in warm rooms. He had explained every sign away. He thought the tingling came from sitting too long, the dryness came from age, and the cold feeling came from winter. His blood sugar test told a different story. He had diabetes and did not know it. Stories like his are not rare. In the United States, recent CDC data showed that 4.5% of adults had undiagnosed diabetes, and the percentage was even higher in people age 60 and older. The first sign I want you to notice is tingling or numbness. Many people describe it as pins and needles, buzzing, or a strange, sleepy feeling in the toes. They shake the foot, change position, and hope it passes. Sometimes it does pass for a while, which makes it even easier to ignore. But when tingling keeps returning, especially at night or during quiet moments, I think about early nerve damage. High blood sugar can slowly injure the tiny nerves in the feet. Those nerves stop sending clear signals, so the foot may feel less or it may feel odd things that are not really there. This is often the first warning that diabetes is affecting the body. A daily walk, even a gentle one, can help circulation. Cutting down on sugary foods also matters because each steady day is kinder to those nerves than you may realize. The second sign is burning feet, especially at night when the room is calm and there is nothing to distract you. Patients tell me the soles feel hot, as if they are near a heater, even when the skin is cool to the touch. Some say they throw the blanket off because the heat feels unbearable. Others say it keeps them awake and leaves them exhausted the next morning. Many people blame tiredness, long-standing, or warm socks. But burning feet can mean that damaged nerves are misfiring. Instead of carrying normal messages, they send false signals of heat and discomfort. This kind of nerve pain can come and go in the early stage, which makes people delay help. I encourage better hydration because the body works best when it has enough fluid. I also encourage meals with more fiber because steadier blood sugar helps calm the storm that damaged nerves create. The third sign is a wound that heals too slowly. This is one of the most serious signs, and I never want anyone to dismiss it. A tiny blister, a cracked area, or a small cut from trimming nails may seem harmless. But if that spot stays open, red, or sore longer than expected, I pay close attention. Diabetes can damage blood vessels, and that means less oxygen and fewer nutrients reach the injured skin. At the same time, the immune system may not respond as strongly as it should. The result is a wound that lingers, deepens, or becomes infected. This is how a small problem can become a large one. If you have diabetes, or even suspect it, you should look at your feet every day. If you notice a wound, clean it gently and seek care quickly. Delay is where danger grows, and fast attention can save tissue, comfort, and mobility. The fourth sign is skin discoloration. I am talking about skin that turns darker, reddish, bluish, pale, or uneven in a way that is new for you. Some people notice patches near the toes. Others see the whole foot looking dull or oddly blotchy. They may think it is just a change in skin tone, a bruise they forgot about, or a harmless effect of age, yet color tells a story. Healthy tissue needs blood, oxygen, and warmth. When circulation drops, the skin often changes its appearance before pain becomes severe. Poor blood flow can be linked to diabetes, especially when blood sugar has been high for a long time. I tell my patients to compare both feet in good light. If one foot looks very different from the other, that matters. Simple foot exercises and gentle elevation can support circulation, but new discoloration should never be left without medical attention. The fifth sign is chronic dryness and cracked heels. At first, this may seem like the most ordinary problem in the world. Many older adults have dry skin, especially in cold weather or dry climates. But when the heels stay rough, split deeply, or seem impossible to soften, I start thinking more carefully. Diabetes can damage the autonomic nerves, the nerves that help control automatic body functions, including sweating. When those nerves do not work well, the feet lose natural moisture. The skin becomes dry, fragile, and more likely to crack. Once cracks form, bacteria can enter, and infection can begin quietly. That is why I never call deep heel cracks a cosmetic issue. I call them an opening that the body does not need. Daily moisturizing, except between the toes, is helpful. Drinking enough water helps too. Healthy skin is not just about comfort. It is part of your body's protection. The sixth sign is swelling, also called edema. Many people tell me their socks leave deep marks, or their shoes feel tight by the end of the day. They often blame standing too long, hot weather, or being less active than they used to be. Sometimes those reasons are true, but when swelling becomes frequent, noticeable, or harder to explain, I look deeper. Diabetes can affect the kidneys over time, and when kidneys are not working well, the body may hold on to fluid. That extra fluid often collects in the lower legs, ankles, and feet. Swelling can also reflect circulation trouble, inflammation, or heart strain, so it is never a symptom I take lightly. Putting the feet up can help reduce mild swelling for a short time. Reducing salt may help some people as well. But if swelling is new or worsening, it deserves a real medical check, not a guess. The seventh sign is sharp or electric foot pain. This is different from the soreness that follows a long walk or a busy day. People describe it to me as stabbing, zapping, shooting, or sudden pain that flashes through the foot without warning. Sometimes it happens while resting. Sometimes it wakes them from sleep. Many assume it is arthritis, an old injury, or simply another part of getting older. Yet, this kind of pain often points to overactive or damaged nerves. When nerves are injured by high blood sugar, they can send pain signals even when nothing is touching the foot. It feels confusing because the pain is real, but the cause is hidden. Gentle stretching may bring relief. A light foot massage can feel soothing if the skin is intact and not tender. Still, when pain feels sharp, strange, or electrical, I want blood sugar checked and nerves evaluated before the damage moves further. The eighth sign is constant cold feet. I do not mean the occasional chill on a winter day. I mean feet that feel cold again and again, even when the room is comfortable and other parts of the body feel fine. Many people laugh it off and say they have always had poor circulation. But when this feeling becomes stronger over time, I become concerned. Diabetes can damage blood vessels and narrow the pathways that carry blood to the feet. Less blood flow means less warmth, less oxygen, and less healing power. Cold feet can also happen with nerve damage because the brain receives confused signals from the feet. Either way, it is not a sign to ignore. Brisk walking, as much as your body safely allows, can support circulation. Even a steady daily walk helps more than many people realize. But if the feet stay cold and look pale or shiny, I want a doctor involved quickly. The ninth sign is hair loss on the feet or toes. This one surprises many people because it seems so small. They tell me they simply thought hair stopped growing there with age. Sometimes age does change hair growth, but when the feet and toes lose hair along with other symptoms, I pay attention. Hair follicles need blood supply just like skin and muscle do. If circulation is failing, those follicles may not get enough nourishment, and hair growth slows or stops. The skin may also look smooth, thin, or tight. This is a quiet sign, but it can say a lot. It tells me the feet may not be getting what they need day after day. When I see hair loss on the feet combined with numbness, color change, or slow healing, I do not wait. I strongly advise a blood sugar test and a circulation check, because the body may be sending a warning earlier than expected. What makes these signs so important is how they often unfold in a pattern. First, blood sugar stays high more often than it should. Then, the nerves become irritated, and strange feelings begin. Tingling comes first for some people. Burning or sharp pain comes next for others. After that, blood vessels begin to suffer, and circulation drops. The feet may look different, feel colder, or heal more slowly. The skin dries out because the nerves that support sweating are no longer doing their job well. Cracks appear. Tiny injuries become stubborn wounds. In some people, the kidneys begin to feel the burden too, and swelling enters the picture. None of this usually happens in one dramatic day. It creeps forward, one ignored clue at a time. That slow pace is exactly why people miss it. The danger is not always loud. Very often, it is patient, silent, and persistent. This is the moment in the story where I need to be completely honest with you. If these warning signs are ignored, the consequences can become severe. A numb foot may not feel a blister forming inside a shoe. A dry, cracked heel may invite infection. A slow healing wound can turn into an ulcer. Once an ulcer forms, poor circulation and nerve damage make recovery much harder. In the worst cases, tissue dies because it is not getting enough blood, or infection spreads faster than the body can control it. That is when people begin hearing frightening words like debridement, hospitalization, or amputation. I do not say this to scare you for the sake of drama. I say it because many serious diabetic foot problems began as something that looked small and manageable. Diabetes can damage nerves and reduce circulation to the feet, which raises the risk of ulcers and limb loss when problems are missed. Source: the good news is that there is a clear path forward, and it begins with daily habits that are simple enough to start right away. I often tell my patients that the body loves steady care more than grand promises. Walking for 20 to 30 minutes a day can improve circulation, support blood sugar control, and help the legs and feet stay active. That walk does not need to be fast or perfect. It just needs to be regular. If walking outside is hard, walking indoors still counts. Small movement done every day is more powerful than hard effort done once in a while. I also encourage people to wiggle their toes, roll their ankles, and avoid sitting still for long periods without a break. The feet are built for movement. When they move, blood moves. When blood moves, tissues receive more of what they need. Prevention often begins with something as humble as one good walk each day. Hydration is another habit I speak about often because people underestimate how much better the body works when it has enough water. Aim for regular water intake through the day, unless your doctor has given you a fluid limit for a medical reason. A well-hydrated body supports circulation, skin health, and overall balance. Food matters just as much. I tell my patients to think less about punishment and more about steadiness. A balanced plate with vegetables, beans, oats, whole grains, and other high-fiber foods can help blood sugar rise more slowly. Sweets and sugary drinks push the body in the opposite direction, especially when they become daily habits. You do not need to eat perfectly to begin protecting your feet. You need to eat with awareness. Every meal is a chance to lower strain on the nerves and blood vessels. Better food choices are not only about weight. They are about preserving feeling, warmth, and healing. Foot hygiene and daily inspection are among the most valuable protections you have. I want you to actually look at your feet every day, not just assume they are fine because they do not hurt. Check the tops, soles, heels, sides, and the spaces between the toes. Use a mirror if bending is difficult, or ask someone you trust to help. Look for cuts, redness, swelling, blisters, dark spots, cracks, or drainage. Wash the feet gently in warm, not hot, water, and dry them well, especially between the toes. Wear clean socks and shoes that do not rub. Never walk barefoot where you could step on something sharp and not feel it. If your nails are hard to trim safely, get help instead of forcing it. The CDC advises daily foot checks because many serious diabetic foot problems can be prevented when changes are caught early. I also want to say something important for anyone listening who has not been diagnosed with diabetes. You do not have to wait for a disaster before asking for a test. If your feet are showing these signs, ask for blood sugar testing. Ask for an A1C test if your clinician recommends it. Ask for a foot exam. Ask about circulation and nerve function. There is strength in early action. Some people avoid testing because they fear bad news. I understand that fear, but hidden problems do not become safer when they stay hidden. In many cases, early diabetes or prediabetes can be managed with lifestyle changes, careful monitoring, and medical guidance. Even when diabetes is already present, early treatment can slow damage and protect what is still healthy. The sooner you learn what your body is saying, the more choices you have. Knowledge does not take away peace. Very often, it restores it. After all my years in this work, I still believe the most powerful part of medicine is not only treatment, it is awareness. When you understand what your body is showing you, fear loses some of its power. Your feet are not just carrying you from room to room. They may also be carrying a message that deserves respect. Tingling, burning, color change, swelling, wounds, dryness, sharp pain, coldness, and hair loss are not details to laugh off or postpone. They are signs that something deeper may be asking for attention. If you catch those signs early, you may prevent ulcers, preserve circulation, protect your nerves, and avoid life-changing complications. That is why I want this message to stay with you. Look at your feet. Learn they're normal. Notice what changes. If any of these signs appear, speak with a doctor without delay. Early detection and steady habits can protect your health, your comfort, and your independence.